Welcome to our channel Learn and Apply. I am Abrar Hussain. Our today's tutorial is the second part of the tutorial series on how to conduct situation analysis, needs assessment and baseline study. This is the second part. Don't forget to like, subscribe and hit the bell icon for more tutorial. If you have any questions or need further assistance, leave a comment below. We have divided the content into 3 parts to ensure minimum length of the video. In the part 1 of this tutorial, we discuss objectives, why these assessments are important, what is situation analysis, needs assessment and baseline, and we also discuss examples from different sectors, key components of a need assessment, situation analysis or baseline, and the key steps to conduct situation analysis, needs assessment or a baseline study. In this part 2, we will explore each step in detail. Step number 1, preparation and planning, defining the purpose, scope and objectives of the assessment. Step number 2, to gather background information, stakeholder consultation and review of secondary data. Step number 3, to develop assessment tools and methodology, quiz and reflection activity and additional resources. In the third part, which I will upload very soon in 2 to 3 days, we will explore the remaining steps. Step number 4, to conduct data collection. Fifth step, data analysis and interpretation. And the last step, compiling findings, recommendations, action plans and developing a comprehensive report. If you haven't watched part 1 yet, I highly recommend doing so before continuing with this part. Part 1 covers the foundational concepts that will help you understand this section better. You can find the link to part 1 in the description below and here also. On this slide, you can see here the different steps to conduct needs assessment, situation analysis and baseline studies that we already discussed in part 1. Now in this second part, we will discuss each step in detail along with examples from different sectors. The first step in any situation analysis or need assessment is to clearly define the purpose, scope and objectives. What you are trying to achieve with this assessment? Is it to inform project design, secure funding, or to understand the needs of a specific population? Begin by clearly defining the objectives of your situation analysis or needs assessment. Your objectives will guide your data collection and analysis process. If you set clear, properly explained objectives, so that will help in the data collection and analysis stage of these studies. All the materials and templates used in this video tutorial are available in a folder. Link is given in the description of the video on YouTube. Key activities in this step 1 are the scope, to define the geographic area, population and sectors, and the next activity is to define objectives, clearly outline the goals of the assessment and what you aim to achieve. Identify target sectors, establish key assessment questions, identify the analysis team and analysis plan, because you might be working in different sectors, so you will need to include experts from each sectors like education, health, wash, protection. And then the next activity is consultation with stakeholders such as community leaders, government representative and NGOs. If the goal is to improve child health and education, so your objectives might include assessing the current health status of children, school attendance rates, and access to clean water and sanitation facilities. In an education sector, identify the need to improve literacy rates among children aged 6 to 14 in rural areas. or assess the educational needs of children in post-conflict area to design a new schooling program. These are the different examples for objectives related to education sector. Here are some examples related to health sector. Your objectives could be to assess the availability and quality of maternal health care services in urban or rural areas, to understand the healthcare gaps in rural communities to improve service delivery. In a wash sector, your objectives could be to determine the access to clean drinking water in flood-affected region, assessing the availability and quality of water sources in affected region. For a protection sector, your objectives might be to evaluate the safety and well-being of children in conflict zones, understanding the risk faced by vulnerable groups like women and children in refugee camps or other children with disabilities, etc. Here you can see examples of objectives related to these different sectors that we already discussed in our previous slides. After completing step number one, when you define the objectives, assessment questions, etc., so then we need to start step two, which is to gather background information, stakeholder consultation, and review of secondary data. At step number two, we need to gather all relevant background information. This includes reviewing existing reports, previous assessments, policy documents, and any other data that provides context to the area and sector you are focusing on according to your objectives. Key activities in this step number two are literature review, secondary data analysis, and stakeholder consultation. Literature review to review existing studies, reports, and policies related to the sector and region. Secondary data analysis to analyze available data from sources like government databases, UN reports, and NGO publications. This includes reports, surveys, and research studies that provide insight into the current situation in your sectors of interest. Next activity in this step number two is stakeholder consultation to engage with key stakeholders relevant to your project sector to understand their perspectives and gather additional insights. These are the key activities in step two: literature review, secondary data analysis, and stakeholder consultation. Let's discuss some examples related to these different activities in step number two. In education sector, you will need to review reports on literacy rates, school attendance, and government education policies. In a health sector, you will need to analyze health surveys, demographic health data, and WHO reports on disease prevalence. In a wash sector, you will need to examine water quality reports, sanitation inventories, and community feedback. Review government, United Nations, INGO reports on water quality and sanitation facilities. In a protection sector, literature review examples could be to look into the UNHCR reports on refugee protection and local laws on child protection and other protection. You could look at reports on gender-based violence or child protection issues. Identifying key stakeholders and involving them in the process is very useful. We need to engage stakeholders throughout the process, as engaging stakeholder and their input ensure that your analysis is grounded in the realities of those you aim to serve. For example, in education sector, we will need to involve school administrator, teacher, students, and parents. In the health sector, we will need to engage with health workers, patients, community health volunteers, and local health authorities to gather diverse perspectives on health services. Similarly, in a wash sector, we will need to work with local water committees, community leaders, and public health officials to ensure the analysis covers all aspects of water and sanitation. In a protection sectors, we will need to collaborate with legal aid organizations, community protection groups, and vulnerable populations to identify protection needs and gaps. These are basically some examples related to stakeholder engagement in different sectors. Examples for community consultations like to engage with community members to understand their needs, preferences, and perceptions. You will need to conduct interviews with local leaders, service provider, and other key stakeholders. Here is a brief activity for you. Create a stakeholder map for your project and outline a plan for engaging each group. This is a stakeholder mapping exercise. You will need to identify key stakeholders for your project and how you would engage them. Do share in the comments with us. The key data points for this step number 2 would be sources like government, UN, INGO reports, surveys, research studies. For a study related to education sector, you will need to obtain the data of enrollment rates, number of children enrolled in primary, secondary, or tertiary education. Similarly, literacy rates, percentage of the population that can read and write at a specified age, teacher-student ratio, number of students per teacher, indicating the level of attention each student may receive, dropout rates, percentage of students who do not complete a level of education, access to educational material, availability of textbooks, learning aids, and digital resources, school attendance, average attendance rates of students indicating engagement and barriers to education. So these are basically examples of some key data points that you will need in education sector project. The key data points for health would be mortality rates, infant mortality rates, maternal mortality rates, and life expectancy. These are the different data points. Similarly, data points related to disease prevalence, rates of common diseases such as malaria, HIV, TB, etc. Immunization coverage, percentage of children vaccinated against preventable diseases. Other data points in a health sector would be access to health services, availability and accessibility of healthcare facilities, including distance to nearest clinic or hospital. Nutritional status among children and adults, availability of health personnel, number of doctors, nurses, and other healthcare providers per population. So these are basically some key data points for you related to a health sector. Here are examples of key data points for wash sector. And on this slide, you can see the examples of key data points for protection sector. So far, we discussed step number one, preparation and planning, defining the purpose, scope, and objectives of the assessment. Then we discussed step number two, which is to gather background information, stakeholder consultation, and review of secondary data. Now we will discuss the third step, which is to develop assessment tools and methodology. With a clear purpose and background information in hand, if you properly complete the first two steps, you would have a clear purpose and background information in hand. Now it's the time to develop the tools and methodology for your assessment studies. This includes deciding what data you need, how you will collect that data, and what tools you will use. This is basically primary data collection where you gather fresh information directly from the field. This can include surveys, focus group discussions, key informant interviews, and observation. Focus group discussions are basically discussions with a group of 8 to 10 people from relevant stakeholders. Key informant interviews are open-ended questions from stakeholders in the department or in the community. In a health project, you might conduct surveys on healthcare access or interviews with health workers. For a project in education, you can hold focus group discussions with teachers and parents to understand barriers to education. Key activities in this third step are data requirement, identify the specific data you need for your assessment, and then you need to choose your data collection methods such as surveys, interviews, focus group, or observational studies. Next activity in this step is to develop the tools to create or adapt tools like questionnaires, interview guides, and checklists. Let's discuss each activity. Data requirement. We will need to identify the specific data you need for your assessment. Sector specific data, like in education, we will need data related to enrollments, literacy levels, school infrastructure, teacher student ratio. In health, we will need data points related to disease prevalence, healthcare facilities, access to medical services. Similarly, in AWASH, our data requirement would be to obtain data related to access to clean water, sanitation facilities, hygiene practices. In a protection, our data requirement would be incidence of violence, child protection issues, legal and social services availability. These are examples of the data requirements related to different sectors. Here are some examples related to the second activity, which is to choose your data collection methods. For example, surveys, interviews, focus group, observational studies. You might need all of these different methodologies for your study. Focus group discussions are basically discussions with a group of 8 to 10 people from relevant stakeholders. Key informant interviews are open-ended questions from stakeholders in the department or in the community. Here are some examples related to tool development. Tools like questionnaires, interviews, guides, and checklists. You will need demographic information. Usually we add this section in the start of our tool. Demographic information is to collect data on population size, age, gender, household size, and other relevant demographic information. You will need to add other information in the tools. For example, if it's education, add questions related to survey local schools to gather data on students enrollment, dropout rates, and the condition of school buildings. If it is a health sector project, so you will need to gather data from health records, patients interviews and facility assessments, number of prenatal visits in a given area and other data requirements. For tools in wash sector, you will need to use water quality tests, household surveys, and observational studies. If your sector is protection, so you will need to add questions related to incidents of violence, child protection issues, legal and social services availability. All the materials and templates used in this video tutorial are available in a folder. Link is given in the description of the video on YouTube. You can download all this material. Here is a sample survey template for you. When we develop tools for data collection, so we start from demographic information, name, age, gender, location, and then we start with our questions related to that specific sector. For example, what are the main challenges you face in accessing, and then you can add that sector specific service. For example, if you are developing this tool for education, so you can add here what are the main challenges you face in accessing schools. If it is health, so what are the main challenges you face in accessing healthcare services? Similarly, other questions could be how often do you experience these challenges? What improvements would you like to see? And are there specific area or groups that are more affected by these challenges? And do you have any suggestions for addressing these issues? So this is basically a sample of a survey template. You can customize this survey template according to the sector you are focusing on. Here you can see a health sector survey template. There is an introduction. We are conducting a survey to understand the health needs of your community. We must add this introduction in our tool. When the data collector is starting collecting the data, so that should introduce the purpose of the tool and the data collection to the participants. And here you can see some questions, demographic information and health status. Do you have any chronic health condition? Yes, no question. If yes, please specify. How often do you visit a healthcare facilities? Weekly, monthly, rarely, never. These could be your options for close-ended questions. Similarly, related to healthcare access, you can add question like how far is the nearest healthcare facilities from your home? And then you can add options like less than 1 kilometer, 1 to 5 kilometer, etc. What are the major barriers to accessing healthcare? Cost, distance, quality of services are other options you can add. Regarding health needs, you can ask question like what health services do you feel are lacking in your community? And then you can add different options related to some suggestions from the participant. You can add question like what improvements would you suggest for the local health services? So this is basically a survey template for a health sector study. This is a template for focus group discussion. In a focus group discussion, mostly our questions are open-ended. Here you can see the different questions, current healthcare services. And as I mentioned earlier, that focus group discussions are conducted with 8 to 10 participants. You float a question in the group and then have some discussions, ask sub-questions, and then record your notes. Related to current health services, you can add questions like what are your thoughts on the current healthcare services available in your area? Are there any particular services you find inadequate? Barriers to access? What challenges do you face when trying to access healthcare services? How do these barriers affect your health and well-being? What additional health services do you think are necessary in your community? How can healthcare services be improved to better meet your needs? So this is basically a template for focus group discussion in a health sector. Template for interviews in a health sector. Interviews are conducted one-on-one. Here are some questions related to personal health experience. Can you describe your overall health status and any ongoing health issues? How have these issues impacted your daily life? How do you usually seek medical care? What factors influence your decisions to seek or not seek medical care? How would you rate the quality of health services you receive? What changes would you like to see in your local health services? and what future health needs do you anticipate for yourself or your community. Survey template for education sector, demographic information, and then you can see these questions. Are you currently enrolled in any education program? How would you rate the availability of educational resources? What resources do you find lacking? What additional educational services or programs would benefit your community? And what improvements would you suggest for the local education system? So this is a survey template for education sector. Focus group discussion guide for education sector. What are your thoughts on the current education services provided in your community? Are there specific areas where you feel the education system is lacking? Similarly, all these questions you can read. This is a template for focus group discussion in education sector. An interview template for collecting data in education sector. Personal educational experiences, education access and quality, resource needs, and future educational needs. Here is a survey template for WASH sector. In the WASH sector, if you are collecting data, so you will again need this demographic information, then water access related question, sanitation facilities related questions, hygiene practices related question, and questions related to suggestions from the community. Here is a focus group discussion guide for WASH sector. You can see these questions related to current WASH services, barriers to access, WASH needs and improvement, and community involvement. Similarly, here is an interview template for WASH sector. Questions related to personal WASH experiences, service quality, barriers and needs, and future needs. So far in this complete series of the tutorial on conducting studies, in the part 1 we discussed objectives, why these assessments are important, what is situation analysis, needs assessment and baseline, and we also discussed examples from different sectors, key components of a need assessment, situation analysis or baseline, and the key steps to conduct situation analysis, needs assessment or a baseline study. If you haven't watched part 1 yet, I highly recommend doing so. Part 1 covers the foundational concepts that will help you understand this section better. You can find the link to part 1 in the description below and here also. In this part 2, we discussed step number 1, preparation and planning, defining the purpose, scope and objectives of the assessment. Step number 2, to gather background information, stakeholder consultation and review of secondary data. Step number 3, to develop assessment tools and methodology, quiz and reflection activity, and additional resources. In the third part, which I will upload very soon in 2 to 3 days, we will explore the remaining steps. Step number 4, to conduct data collection. Fifth step, data analysis and interpretation. And the last step, compiling findings, recommendations, action plans, and developing a comprehensive report. I hope this tutorial helped you conduct successful assessment studies. I will upload part 3 soon. Thank you for watching. Don't forget to like, subscribe and hit the bell icon for more such tutorial. If you have any questions or need further assistance, leave a comment below. Feel free to leave any feedback or suggestions for topic that you would like us to cover in our future tutorial. Have a great day. See you in the next video, part 3 of this series.